All right, I'd like to call on Macomb City Council to order, please. If you'd, those of you that are present here in person, if you'd please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. If the clerk would call the roll, please.
Mike Wayland.
Here.
John Vajezi.
Here.
Annette Carper.
Here.
Tom Cook.
Present.
Gail Carper.
Here.
Tammy Lee Brown Edwards. Okay. Dennis Moon.
Here.
6 present.
We have a quorum. Thank you. Council, before you is a consent agenda, and a motion is in order.
Move to adopt as published.
Second.
Been moved and seconded to adopt the consent agenda as published. Any discussion? Hearing none, roll call, please.
Wayland.
Aye.
Vajezi.
Aye.
A. Carper.
Aye.
Cook.
Aye.
G. Carper.
Aye.
Moon.
Aye.
All ayes.
Motion carried. Thank you.
Can I ask who the computer is owner, with the name owner?
Don't know.
Okay.
All right. All righty. Does anyone wish to speak to the council under the public comment sections of tonight's agenda?
Yes,
We'll wait till the exterior door closes here, and no public comment. I would like to invite Dr. Ed Card. He's a medical director at McDonough District Hospital. He's present with us via Zoom. And Dr. Card, thanks for taking time out of what I know is a very hectic time for you. And we're grateful to have you here with us this evening. I wondered if you could give us an update on events and happenings and the status of the hospital as it relates to the COVID pandemic.
I would be happy to do so. It's been a very busy 5.5 weeks here. And I'll just kind of start and go down the list here. The first is that we have several tents now present on campus. There are 2 next to the emergency room. The first one is for visitors and employees and those who need to get into the hospital but don't have any respiratory problems. The second tent is specifically for people with respiratory issues, so that as soon as they get into the tent, we can have them don a mask to prevent any contamination. They then get screened with temperature and digital oximeter to see if their oxygen level is good. If they are acutely ill, then they are moved into the emergency room. But if they are not acutely ill, then we ask them to either go home or to call their primary care provider so that we minimize the risk of contamination of the hospital from someone who probably can get by without going to the emergency room. The third tent is a drive-through tent that we have set up to help with testing. In order to get a test, you have to have an order from a physician and you must be pre-registered. And that can be done through the triage hotline. That phone number is 836-1715. And they will both perform a screen through our protocol and will also assist in pre-registering. When people go through for the first time, they will be tested for influenza A and B, possibly for strep throat and for RSV. If that initial screen is negative, and their physician wants, then we can go ahead with COVID testing at that time. We also are offering routine lab draws in the tent, the drive-through tent, from 7 in the morning till 11 in the morning. And again, an order and pre-registration is needed. Between 7 and 8, we are not doing any COVID testing, so people who may be immunocompromised can come at that time and avoid any exposure to folks in the hospital or to anyone who may be carrying the virus. Under clinical activities, in order to get us ready I asked Dr. McPherson to be in charge of inpatient preparedness, and he's done a wonderful job of getting things going there. Dr. Sparks has been in charge of infection control and PPE conservation. And then Dr. Reeves is the chair of our ethics committee, which met to discuss how we might proceed if we got into a situation where we had more people who needed ventilators than we had ventilators. So we have a process in place for that, should that become necessary, and hopefully it won't ever. Additionally, there's been support of independent practices by the hospital, setting up independent contractor contracts. Dr. Biagini and Dr. White are both going to be working for the hospitalist service, and offers were made to other independent physicians as well. We've had some facility changes to East, which had previously been used as our OB department while the Cater Schweitzer building was under construction, has now been converted into a COVID wing. There are 10 beds available on that wing, 3 of which could accommodate ventilators if needed. And there's a vestibule at the entry, so we can come partway in, don the protective equipment, and then move into the ward and stay there and not have to use multiple changes of equipment. The senior behavioral health area, which was closed last year, is now a 12-bed critical care unit with all of those rooms capable of accommodating ventilators. It would be used if we had more than 2 or 3 people with COVID who required ventilators. That would allow us to isolate the COVID patients at the other end of the building and maintain our normal 7-bed ICU for other problems such as heart arrhythmias and other such problems that we take care of in the intensive care unit. The ambulance garage has been set up with a 10-bed unit, which will be used to evaluate people who do not have respiratory problems. It's more of an open area, so we're reserving the rooms with doors that we can close for those who have respiratory illness, again, with the idea of minimizing the possibility of contamination of the emergency room. As a result of these changes, we have a total of 60 beds now available, up from our 48 that we previously had. We have 19 ICU or CCU beds with an additional 3 rooms available to accommodate ventilators, so we could accommodate 22 patients on ventilators if called upon. We have 12 ventilators in the house available for immediate use, and we have requested 11 additional ones from the state. I'll hit a few high spots on testing. Right now, there are 2 means of getting tests. One through IDPH, Department of Public Health, and their criteria are for hospitalized patients with pneumonia of no other known cause, symptomatic healthcare workers, because if they are indeed carriers of the virus, we do not want them around sick people, and if they're not, we'll want them back at work as soon as we can. Symptomatic patients from congregate housing, such as nursing homes, prisons, and the like, and symptomatic employees of congregate housing. Physicians are free to order COVID tests if they feel it is appropriate, and those are done through LabCorp. The virus itself continues to be somewhat frustrating. Recently discovered that about 20% of people who carry the virus are asymptomatic, and that pre-symptomatic spread has been documented. The other unfortunate fact about that is that the maximal time of viral shedding is between 2 and 3 days before you get symptoms. The fortunate thing is that about 80% of folks will have a mild illness, they'll be treated at home, and will recover uneventfully. The mortality rate is difficult to assess because we don't have a good denominator. We haven't done any testing of the general population, but it appears to be around 1%. in the United States. One of the symptoms that has come up that is particularly or is particular to this particular illness is that you can develop a loss of smell for reasons that aren't entirely clear, but it's one of the signal symptoms for the infection. That's what we've been up to thus far. I'd be happy to entertain any questions that you all might have.
Thank you, Dr. Card. Does anybody have any questions for Dr. Card? I can't. We'll open it up for that.
Not a question, but I just wanted to say thank you to all of the people that work at MDH for doing such a good job and keeping on top of all of this. Even though we haven't had a lot of cases here, I'm thrilled that you're taking it this seriously. So thank you to everybody out there.
You're very welcome. This has been the ultimate team sport, and Warren County went from 2 to 10 overnight. So our 3 is a small number, but it is not predictive of what might be down the road.
Dr. Card, I want to tell you how really grateful I am. I know that, and being witnessing some of the events unfolding over the last, like you said, 5 or so weeks, very impressed with the staff and particularly your leadership at the hospital in preparing the institution to deal with this issue. I can't tell you how impressed I am and grateful, and I think your words here should reassure the folks in the community that the hospital is as prepared as it potentially or possibly could be for this event. And I know that you've continued to tweak and hone and make improvements. I would just ask a couple of questions, if that's all right. What you've shared with us about the 20% of the carriers are asymptomatic. Would you then, and I think I know the answer, but I'm hoping that you'll be, we'll be on the same page. I know we will be, but does that underscore, in your medical opinion, all more the importance of the use of social distancing, washing hands, uses of masks, things like that?
Absolutely. I think, when you figure that 20% of people are walking around, or 20% of people who have the virus are walking around not knowing they have it, and those that have it and are yet to be symptomatic are maximally contagious 2 to 3 days before they get symptoms, I don't think there's any other choice. We absolutely have to control secretions, and the most effective means of doing that is to wear a mask. And when I wear a mask, I'm not protecting myself, I'm protecting everybody else. And so the wearing of a mask, by my opinion, becomes essentially a civic duty at this point to protect our fellow citizens.
I appreciate that. Anybody from the chambers here have any more? Anyone else from the council have any questions for Dr. Card? Well, again, Doctor, I'm most grateful for your time with us today. I think it was important, everything you shared with us, very important for the public to hear. And if you'd express our gratitude to everyone back at MDH, we'd really appreciate that.
I will absolutely do so, and thank you for the opportunity to fill you in.
Thank you, Dr. Card.
Thank you.
Alrighty, council, move on to unfinished business. Item number 1, consideration of an ordinance to amend Chapter 22, Article 2 of the Municipal Code of the City of Macomb to expand taxi cab services to include transportation network companies. This will be second reading.
Thank you. As was stated, this ordinance is for second reading, being the proposed amendments to Chapter 22. This particular set of amendments would be addressing the transportation network companies, which is the definitional name for what would be commonly known as Uber, Lyft, and other rideshare services. These particular TNS providers do exist and have a right to be within the city. And what this particular proposed amendment will do is put them into the same category with taxi cabs as far as how they will interact, and having them relate to registering with the city, so the city will be aware and be able to make sure that the persons that are operating these vehicles will remain in good standing with their license and a myriad of other requirements that also apply to taxi cabs.
Thank you. That'll stand as second reading. We'd entertain a motion to adopt.
Move to adopt. Second.
It's been moved and seconded to adopt. Any discussion? Anyone on the Zoom meeting have any comments or questions? Alrighty, hearing no further discussion, roll call, please.
Sorry. He saw a squirrel. I'm sorry.
Vajezi,
Aye.
A. Carper,
Can you come back to her?
yeah, Cook,
Aye.
G. Carper,
Aye.
Brown Edwards,
Aye.
Moon,
Aye.
Wayland,
Aye.
A. Carper.
Aye. Sorry.
That's okay, all ayes.
Motion carried. Thank you. Item number 2, consideration of an ordinance to amend the city fee schedule, increasing debt service fees for water service, and increasing water rate by amending 24-3G, and to increase solid waste collection fees by amending 24-1A of the municipal code. This will be second reading.
Thank you. Again, this is an ordinance proposing amendments to the city fee schedule, all contained in Chapter 24. And again, this is second reading for the amendments that would be addressing garbage and trash, being 24-1, subsection A, an increase by $1 to a total of $20.26. And there are 2 proposed amendments to 24-3, subsection G, being the service rates for the city. And again, this would be addressing the rate specific per 100 cubic feet. It would be an amended, the resulting amendment rate would be $5.04 per 100 cubic feet. And the service rate for the minimum charge would have an increase in the debt service. And again, this is debt service only per meter to a resulting total of $8.
Thank you. That'll stand as second reading. Motion is in order.
Move to adopt. Second.
Moved and seconded to adopt. Any discussion?
Yes, Your
Yeah, I
Honor.
have a question.
Alderman Carper.
This is Gail Carper. Can we vote on these 3 increases separately, or do they have to be voted on all together?
They're written in one ordinance. As far as doing them separately, you would have to make a motion to amend the ordinance, not necessarily voting on them separately. That would be a motion to have the ordinance written into separate, what you'd be motioning is to have a certain amendment stricken from this particular ordinance. And by that, you would be, I guess, making a no vote for a particular section. Otherwise, it's in one ordinance action. So a complicated answer, but yes, you could do it, but you wouldn't be doing that vote this evening. It'd have to be rewritten then. If you chose to take something off, it would then have to have a separate ordinance.
Well, the reason I ask is that I in the past, when we've done debt service fees, and I think this will be the 3rd or 4th one since I've been on the council, I voted against it because I don't like the idea of a flat fee on every user. It has a disproportionate effect on people with lower incomes and on fixed incomes. And that seems even more important to me now with so many people losing their jobs. So, you know, I can see a different argument for the water rate and for the solid waste collection fees, but if we have to vote on them all together, then I'm not in favor of increasing the debt service fee for those reasons that I've expressed prior to this, that they are disproportionately harsh on people with low incomes.
Thank you. I heard somebody else ask for the floor.
Yes, Your Honor.
Alderman Vajezi.
Alderman Vajezi. And also, as in turn what Alderman Carper said, I have received some phone calls in reference to this. Unfortunately, because of COVID-19, a number of people have lost their jobs, and I completely understand why we're trying to do this. We do need to make sure that we're covering all of our bills as we're moving forward. Unfortunately, the timing of this is not ideal for a number of people. So, you know, with the people in my ward stating that they're not in favor of this at this time, I would have to vote no for this also. I have expressed to them that if we did not do this or maybe moved it down the road, that potentially it could be a higher rate if we decided to move it till next year, and they were understandable about that.
Thank you. Anyone else?
A couple comments.
Alderman Moon.
Years ago, we went to the debt service because the rate increases were not keeping up with the required money to pay off the improvements to the water plant. That's why we went to a debt retirement plan. To raise the rates enough to cover that, we would probably be over the top on rates in the comparable communities. So that's my comment on that. I'll refrain from that other one. So,
Okay.
but that, I think that's a very important fact on why we went to a debt retirement. We couldn't raise the rates high enough to cover the cost of debt retirement.
This is Gail Carper again. I understand that. I think we've had this discussion before. And what I am objecting to is that it's the same increase on everybody. And it doesn't affect everybody the same. We've had presentations before on assessing different debt service fees depending on some different types of delivery of water service, and we've rejected those. And those
go ahead.
Those seem to me to be a fair way of assessing this type of a fee on people.
Well, I don't have the figures in front of me, and I don't have the ability to do them right now, but I would venture to guess that if we were to raise the fees of the water costs high enough to take care of the debt retirement, it would cost everyone a lot more than what we're proposing today.
Thank you. Scott, Mr. Administrator, can you remind us what the number is here that you shared? I think we may have given some information we need to correct officially from the previous meeting, but I think you shared it with the alderman.
Yes, so what I spoke about last week was incorrect. The total amount estimated for an average residential account would be a $5.25 per month increase.
That'd be
$1
for
total, but it'd be $1 for the garbage, $3 for the debt service, and on average a $1.25 increase for the user fee increase.
Right. Okay, thank you. And I would note in the financial statements that are provided with your agenda, this packet this week, you'll notice I would call your attention to the water user fees only section, and it shows that we're trending about $250,000 off comparable year-to-date FY 19-20 to FY 2021, and that's the reality of the rate structure the way it currently is. Any more discussion this evening?
Yes,
Mr.
Your
Mayor?
Honor.
Oh, I'm sorry.
Go ahead, Ms. Brown.
Alderman Brown.
Mr. Mayor, would you explain to us what the fee schedule would be? I'm sorry, when it would start?
Sure. If the action was approved this evening, the water rate increase, the debt reduction amount, and then the garbage fee would go out to the first billing cycle, the 10th of May, due and payable on the 25th of May, so well over a month from now. The second cycle goes out the 20th of May and would be due and payable on the 5th of June, and the third cycle goes out on the 30th of May, due and payable on the 15th of June. So folks would have anywhere from 30 to 45 days notice of an approximate average of $5.25 per month impact. And did I hear someone else as well?
Yes, Your Honor, this is Annette.
Alderman Carper.
Yes, sir. So I just want to verify again that the debt service is at $3. Previously, we spoke between 3 and 8, and I did hear, Attorney Kristen talk about and I swear I heard $8, and not to get hung up on $8, but I just need to be assured that the debt service is at $3.
So $3 increase?
$3 increase. I think that's where I misspoke last week. It's
Right.
currently $5 for our debt service for water. And we're proposing to go to $8, and thus the $3 increase.
Okay, and so that includes the sewer increase and the garbage increase. So all total would be that $5.25.
The water fee increase. We're not doing anything to the sewer rates.
Okay, garbage, excuse me.
Yes.
Yep, there you go.
Yes.
Okay. So my view on this is that I believe that we have to take care of our city bills. We cannot help the city is in a contract with Waste Management, and that bill has gone up, correct?
That's correct.
And then our water bill has gone up. So I think that we're obligated, unfortunately, that cost has to go to the consumer. I think we're all generally concerned about the debt service. I think it's important for our public to know as well that we have not had an increase in rates, gentlemen, since 2014, you told me, Mr.
Correct.
Coker?
That's correct.
And while I think it is a terrible time, it's a terrible time for everyone, but is next year going to be a better time? And then next year, we're 7 years since we haven't had a rate increase. Well, those would be my thoughts.
Okay, thank you. Anyone else?
What
Hearing
would
no-
happen, this is Jerry Roberts,
Mr.
what would
Roberts.
happen if we tabled this for a month and see what happens with all this virus ordeal?
That would have to be a motion from an alderman, Mr. Roberts, and the reality is that that would have to come from the council.
Our revenues are down.
The revenues are down, and the impact, I think we shared last 2 weeks ago, is somewhere
$20,000.
between $20,000 and $30,000 a month in lost revenue from these sources that we wouldn't otherwise be collecting. Any other discussion? Hearing none, roll call, please.
A. Carper,
Aye.
Could you repeat, please?
Aye.
Cook,
Aye.
G. Carper,
No.
Brown Edwards,
Aye.
Moon,
Aye.
Wayland,
Aye.
Vajezi,
No.
5-2.
Motion carried. Thank you. Item number 3, consideration of an ordinance to adopt a budget for the city of Macomb, McDonough County, Illinois, for the fiscal year commencing May 1st, 2020, and ending April 30th, 2021. This will be second reading.
Thank you. As was stated, this ordinance is for the annual adoption for the city's budget. The city budget has been prepared by the budget officer, which is the city administrator, along with the department heads. The budget has been available for the public for viewing. There was a public hearing held on the same location via Zoom as well, and this location on April 13th regarding the budget itself. There have been no contacts regarding somebody who has not been able to view the budget if they so chose to. And again, this particular annual budget will be for the total amount of $30,044,503 and will be covering the year beginning May 1st, 2020, ending April 30th of 2021.
Thank you. That'll stand as second reading. A motion to approve is in order.
Move to adopt. Second.
It's been moved and seconded to adopt the budget. Any discussion? I would restate some comments that I made last week. Obviously, we have some great deal of unknowns here as far as revenue projections based on the current pandemic. So I think there's every reason to believe that we would be coming to you throughout the next fiscal year asking for your guidance and asking for some support on where we are at with revenue at the time. So with that said, any other discussion? Hearing none, roll call, please.
Cook,
Aye.
G. Carper,
Aye.
Brown Edwards,
Aye.
Moon,
Aye.
Wayland,
Aye.
Vajezi,
Aye.
A. Carper.
Aye.
All ayes.
Motion carried. Thank you. There is no other unfinished business. Under new business, item number 1, a resolution extending the mayoral emergency proclamation declaring a civil emergency due to the COVID-19 pandemic. There's a copy of the resolution as well as the proclamation in your packet. If the city attorney would read the resolution into the record, please.
This particular resolution would be extending the mayoral emergency proclamation that was issued on April 16th of the same year. This particular proclamation was issued in reference to the formal declaration of a civil emergency due to the COVID-19 pandemic. And again, as the state and the nation has declared a state of emergencies and has, by state, the governor has issued the gubernatorial disaster proclamations, and there have been a series of them and extensions. This particular action is a necessary component to the statutory requirements regarding the availability of the FEMA and the IEMA funds that potentially, as well as assistance that may be available for the city, where as the city is working through this COVID-19 pandemic and its effects.
Thank you. We'd entertain a motion to adopt the resolution.
Make a
Move to
motion
adopt.
to
Second.
It's been moved and seconded to adopt the resolution. Any discussion? Just for clarification, Council, we've got a couple of calls since we issued this declaration last week. This restates some of the action that we took several weeks ago, but it most importantly declares a civil emergency to make us ultimately eligible for FEMA and IEMA reimbursement of expenses that are incurred as we work to combat the effects of the virus in the community. And to date, we have just over $30,000 of expenses that we have incurred to deal with the pandemic, and we would anticipate that those would continue to increase. So by and large, this declaration and its continuing resolution are to support our eligibility for reimbursement by the federal and state government. Any other discussion this evening? Hearing none. Roll call, Madam Clerk. Roll call, please.
G. Carper.
Aye.
Brown Edwards.
Aye.
Moon.
Aye.
Wayland.
Aye.
Vajezi.
Aye.
A. Carper.
Aye.
Cook.
Aye.
All ayes.
Motion carried. Thank you. Item number 2, consideration to approve a residential initiative and stabilization effort, also known as RISE application, for Scott Collins, doing business as STC Investments, to demolish 8 properties located at 501, 507, 517, 513, 607, 615, 619, and 627 West Adams Street at a cost of $71,750. with the City of Macomb's reimbursement to be $35,875 per demolition guidelines. There's a memorandum in your packet from the Community Development Coordinator, Mr. Bannon. John, could you go over that for us, please?
Thank you, Mayor. The City of Macomb has launched a local program to work in partnership with property owners to remove abandoned, dilapidated, and blighted housing on a partial reimbursement basis. And the city did allocate $100,000 to the RISE program. Scott Collins, doing business as STC Investments, did apply to the RISE program for 8 properties with an estimated demolition and greening cost of $71,750. The city would reimburse 50% of that demolition cost, $35,875. Due to COVID-19 and the need for Mr. Collins and some of the partners involved to move quickly, the applications are coming directly to City Council and have not gone to the Community Development Committee. So we are requesting the Council approve the RISE action today. On the next page, there is a list of the properties with estimated demolition and greening cost. There's an average cost to the city per property of $4,484.38. I think that this aligns with the city's overall vision for West Adams Street. I think it'll improve the quadrant. It'll work for the all of our partners in the community, not the least of which is Western Illinois University. And I would remind council that this is a reimbursement program, so no funds would be dispersed until every property was demolished and met inspection standards. So if there are any questions on any of the particular properties, I'd be happy to answer them.
Any questions for Mr. Bannon?
Yes, this is Gail Carper. I have one question.
Alderman Carper.
I see in your memo that you talk about the need to move quickly. Is there a timeline with specific dates involved?
It's not a timeline with specific dates, but these properties have mortgages on them, and the primary lender involved is willing to work with Mr. Collins and the city to get these done quickly. But I think that there's a vision here, and so the lender is seeking as quick a process as is feasible.
So possibly within the next, say, 90 days?
I would appreciate it. The property owner has longer per program guidelines, but again, the city wouldn't reimburse anything until there was a demolition that passed inspection procedures.
Okay, so the funds wouldn't be given out till demolition and greening, or just demolition?
It's demolition and greening per the estimates submitted to the city.
Okay, thanks, John.
For the record, Mr. Collins is on the meeting with us. Scott, did you want to add anything to Alderman Carper's ask?
Not that I can really think of. No, I really don't think there is anything.
Do you have a timeline for completing?
Just as soon as weather would allow us to get in there and start, we're going to do, one at a time, with maybe working on a second one while we're finishing up, one. But yes, the sooner we can get it done, the better. But, once again, it's going to be with weather and if we have any other jobs that come up that we have to get done as well.
Okay, thank you. Any other questions for Mr. Bannon? Hearing none, we'd entertain a motion to approve this arrangement.
So moved.
Second.
So moved and seconded to proceed. Any discussion? Hearing none, roll call, please.
Brown Edwards,
Aye.
Moon,
Recuse.
Wayland,
Aye.
Bajesi,
Aye.
A. Carper,
Aye.
Cook,
Aye.
G. Carper,
Aye.
all ayes.
Motion carried. Thank you. Item number 3, and thank you, John. Item number 3, consideration to approve the Illinois Department of Transportation Maintenance Engineering to be performed by a consulting engineer and engineering services proposal from IMEG Corporation, the amount of $26,000 for the 2020 motor fuel maintenance street projects. There's a memorandum in your packet from the Public Works Director, and she is joining us on the meeting as well. Alice, could you go over your memo for us, please?
Certainly. As part of this year's MFT resolution, we are, for the first time, using some of our MFT dollars for maintenance cost, mill and overlay, microservicing at various locations throughout the city. And included in that resolution were engineering funds to be paid for through MFT dollars. We solicited a proposal from IMEG to provide those engineering services for us. And we had budgeted in the resolution for $35,000 total. They're coming in for the pre-engineering cost with $26,000. That will leave us about $9,000 for inspection, which typically, am I still here? Which typically will be less for these maintenance types of projects.
Okay, thank you. Any questions for Alice? Hearing none, we'd entertain a motion to approve the agreement with IMEG.
Make a motion to approve the agreement with IMEG Corporation.
Second.
It's moved and seconded to approve the agreement. Any discussion? Hearing none, roll call, please.
Moon,
Aye.
Wayland,
Aye.
Bajesi,
Aye.
A. Carper,
Aye.
Cook,
Aye.
G. Carper,
Aye.
Brown Edwards.
Aye.
All ayes.
Motion carried. Thank you. Excuse me. Item number 4, consideration to authorize a 2% cost of living increase for the City of Macomb regular full-time and regular part-time non-union personnel effective May 1st, 2020. This is an annual action to bring in our non-unionized workforce the same cost of living benefits that have been negotiated with our union workforce. We'd entertain a motion to approve.
Move to approve.
Second.
Been moved and seconded to approve. Any discussion? Hearing none, roll call, please.
Wayland,
Aye.
Bajesi,
Aye.
A. Carper,
Aye.
Cook,
Aye.
G. Carper,
Aye.
Brown Edwards,
Aye.
Moon.
Aye.
All ayes.
Motion carried. Thank you. Excuse me. Item number 5, consideration to accept City Attorney Kristen Petrie's letter of resignation with regret, effective May 8th, 2020. They're not going to let you do it.
No, we
Consider,
With regret, move to accept the resignation.
second.
It's been moved and seconded to concur. Any discussion?
If we all say no, she can't leave.
Well, might be a civil action there.
Yeah.
But there'll be an opportunity for us to fet her, although very subduedly, sometime between now and May 8th. Is there any other discussion this evening? Roll call, please.
Bajesi,
Aye.
A. Carper,
Aye.
Cook,
Reluctant aye.
G. Carper,
extremely reluctant aye.
Brown Edwards,
Aye.
Moon,
Aye.
Wayland.
Aye.
All ayes.
Motion carried. Thank you. Item number 6, consideration to approve the appointment and the employment agreement with Lisa M. Scalf for the position of City Attorney effective May 9th, 2020. A copy of the agreement is attached, and we'd entertain a motion to approve the appointment and the agreement.
Move to approve the appointment and agreement.
Second.
So moved and seconded to approve. Any discussion?
I have a couple of questions. This is Gail Carper.
Yes, ma'am. Go ahead.
This is on page 3 under medical and other insurance. In the first paragraph, it says that the city attorney agrees to waive rights of herself and spouses to participate in the coverage for health insurance. But then the third paragraph says that city agrees city attorney may participate in any additional health, life, dentist, disability, or other insurance. Maybe I'm not reading that correctly, but it seems like a contradiction to me.
Those are all at the cost of the employee. For example, life insurance and other dental are all options, but they're entirely at the employee's expense.
Okay, because it looked like the way it's written, it looked like it was contradictory. Is that clear then to everybody that the additional health and that's all at the new employee's expense?
Yes.
Okay, just wanted to check.
Was there anything else, Alderman Carper?
I'm just paging through this. Hang on one second. No, I think that was the only question I had. Thank you.
Very good. Any other discussion this evening? For the record, Ms. Scalf is with us here at City Hall this evening for the meeting. And hearing none, roll call, please.
A. Carper,
Aye.
Cook,
Aye.
G. Carper,
Aye.
Brown Edwards,
Aye.
Moon,
Aye.
Wayland,
Aye.
Vajezi,
Aye.
all ayes.
Motion carried. And I would just add that as sad as we are to see Ms. Petrie leave us, we're probably equally as happy to have Ms. Scalf joining our team. So we're looking forward to that. There is no other new business this evening. Under committee reports, I've asked Mr. Jock Headblade, who is the chair of the Heritage Days Committee and also the executive director of the Convention and Visitors Bureau, to join us this evening and give us a report on Heritage Days 2020. Mr. Headblade.
I've unmuted
Yes,
him.
thank you, Mayor. We have had meetings with both my board at the MACVB and with the Heritage Days Committee, and we have been discussing how we move forward with Heritage Days during this COVID crisis that we're in. And it seems that every question that's brought up, there are a number of other questions that come up with it. We discussed many things. The first thing that we discussed was just if indeed the stay at home, the shelter in place, the quarantine, the social distancing were lifted before June. What were the odds of mass gatherings still being an opportunity to happen? And if indeed they were, would those be prudent and responsible things to do? We didn't believe that was going to be a situation there. We also were worried about many things as far as the reunions and that stuff that already seemed to be being canceled and people being laid off, and low turnout for an event like this does affect us greatly in how we pursue and move forward in the coming years, because the money we make each year off of Heritage Days really just goes right back into Heritage Days and gets spent. And so there was that. So there was that concern too. And we also know that there is a situation now where a lot of all the promotional money through our office has been clawed back by the state to try to be put into next year's budget, which was going to give us almost a very difficult time in actually promoting the event for this year. So with those many reasons and those that may come up here at some point in the not too distant future that we don't know of yet, we had decided that the prudent thing to do this year, and it was not an easy thing to do, was to cancel Heritage Days. And so that is the decision that was made for the safety and the health of everybody in our community and those that may be visiting us. That was the idea to do so.
Thank you, Jock. I know that when we discussed this late last week, and we concurred with what you were suggesting. I know one of the things we discussed and was released in a news release just prior to this meeting starting this evening was one of the primary activities that occurs for Heritage Days. It draws people from all over the country back to Macomb, their hometown. And
Exactly.
Unfortunately, that is part of the issue.
Right.
That those folks would be coming from parts of the country that may still be experiencing some profound impact from the COVID-19 virus in those particular areas. And one thing that I sincerely appreciate is that this is going to be one more on a list of disappointments for folks in the community this year. And to that extent, I want to assure everyone that this was not entered into lightly, and that every consideration was given to safety as it relates to the event, and just where we have to be, unfortunately. And go ahead.
If I may add to that, I will say that Heritage Days is very dear to me personally, and this was an extremely difficult thing for us at the MACBB. We know how important it is to the community, and we also understand how important this could be to a community at a time like this too. But we just didn't feel that the risk outweighed the reward on this. So, but it's tough. It's very sad for me to not be able to do this. I get so much joy out of being at Heritage Days and working for it. So.
Well, and we'd like to reiterate what our news release says, and that this decision was made so that with the promise to return next year bigger, stronger, and better than ever to give the community and visitors the celebration that they will certainly need and will have so deservedly earned. So thank you for the report, however disappointing it may be. We appreciate the decision-making process that you went through to get here.
Thank you, Mayor.
Any other committee reports this evening? We do have the complete count census update, so we'd ask Mr. Bannon if he could join us again for an update there, please. I understand we have a bit of good news, and our rates of participation's growing.
Yes, I'd like to thank everyone who participated in the Census Challenge last week and a couple of weeks ago. Our numbers actually spiked about 2.5% that week, so we're a hair under 49%, which is right, which is about 7 points behind the state average, but we were about 9. So we're doing great the last week and a half. So if we can continue that momentum, we'll really be on a good pace. And, and again, a lot of the university communities around the state are a little below the state average, which I think is expected. I would just say there's light at the end of the tunnel with the census data collection window going until Halloween. And I would end with an ask. We made a census video. Thank you to WIU and Phil Weiss and Kristen Terry from the city for working. Tom and Gail Carper, Byron Oden Shabazz, John Meissner, WIU student Miranda Lambert, and the mayor are all involved in it. And our intention is to get diverse voices from around the community to explain, from a lot of different viewpoints, why the census is valuable and why it's important for people to participate. Please, it's 2 minutes, watch it. It's on Downtown Development. It'll be on all the city social media. We'll share it. But please watch it, please share it, and please get the word out on how important it is to fill out the census.
Thank you. Any questions for John?
I have just one quick question.
Ms. Petrie.
So the extension to October for canvassing was officially done, or is it still, it was done?
It's done. It's
wonderful.
done.
Yeah, that's a big plus.
Yeah, and so I mean the apportionment window and the redistrict, that all went too, but for I think what most people care about, October 31st, you can fill out your census online, you can call, you can send in the written form until then. So, especially with a lot of people coming back to Macomb in August, I think we're all thrilled about that.
Absolutely, John. Thank you. Alrighty, any aldermanic reports tonight? Alderman Moon.
Yes, I would ask John to maybe have some numbers for us next week on the Fix and Flatten program. How's it going? And because I've noticed a few houses have been demoed in the last week, and where we stand with that.
Okay, Dennis. John has a quick comment. Go ahead, John.
So, Dennis, one of the buildings that we're going to be demolishing is the Fix and Flatten program. A lot of those are through the Abandoned Properties program, through the grant the city received through the Illinois Housing Development Authority. So I'd be happy to give an update on that. I just want to be clear that a lot of that is through a grant that the city received and not necessarily through our normal Fix and Flatten program.
Well, yeah, I probably had the name wrong, but the program we awarded here not too long ago.
Absolutely. We'll have that for you, sir. Anything else?
That's all.
All right. Alderman Brown Edwards.
Nothing to report, Your Honor. Oh, I'm sorry, I do. Genesis Garden is looking for volunteers to help with their delivering of food and groceries to residents that live within the county. And they are also asking for people to register online or via phone to drop off groceries to them if they are in need. Thank you, Your Honor.
Thank you. Alderman Carper. Yeah.
Just some thanks again to city employees for all of the hard work you've been doing to the hospital. I know it's disappointing that we won't have Heritage Days this year, but I think that the decision was wise. I don't think we can afford to have large gatherings, but I'm seeing lots of acts of kindness throughout the community, and I really hope people who are not wearing masks and keeping distance will start following those guidelines. It's so important, and that's what's going to keep all of us healthy.
Thank you. Alderman Cook.
No report, Your Honor.
Thank you. Alderman Carper.
I just would like to reiterate what Alderman Gail Carper said, and that it is so important that we follow the social distancing guidelines that have been provided to us through the CDC and the WHO and our local health department. I think it's disrespectful not to be following these guidelines, to be honest. I think that we can be a little bit better about wearing our masks when we are out in public and about respecting our social distance.
Thank you. Alderman Vajezi.
Just to reiterate, to wear a mask. Thank you, Your Honor.
Thank you. Alderman Wayland.
No report, Your Honor.
Thank you. Ms. Petrie.
I would have nothing to add this evening, Your Honor.
Okay. Madam Clerk.
I don't have anything.
Thank you. Mr. City Administrator, you've been awful quiet over there.
Nothing to say so far,
Okay.
Mr. Mayor. I only have one comment. I wanted to thank Mark and Mike from University Television for getting the Zoom and YouTube and everything working very well. Seems like
Much appreciated. I do have a couple of mayoral appointments. I would ask for your concurrence in reappointing Mr. Al Rouge to the Macomb Police Pension Board and reappointing Mr. Sterling Edwards to the Equal Opportunity and Fair Housing Commission.
So moved.
Second.
It's moved and seconded to concur with those reappointments. Any discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Motion carried. Thank you. There's a couple of bits of information I'd like to share with the Alderman, if I could. We've been the benefactors here at City Hall, speaking of masks, from a couple of, they're both women or women's groups. We've been very blessed by the Macomb Women's Club, who brought close to, two dozen masks a week or so ago. And then an individual, Bobby Morrison, brought probably close to another 2 or 3 dozen by for us to use here at City Hall. We're very grateful for their kindness, and that will help us here at City Hall and particularly those of us that go out during the day and engage will be able to do that. And with the eye for hopefully getting back into some opening of city government sooner or later, those would be valuable to have here for our staff to use. And I would reiterate what many of you have already suggested about social distancing. I think Dr. Card, I heard him very distinctly talk about one of our neighboring counties went from a very low number that exponentially overnight changed. I think there's unfortunately every reason to believe that we will likely have more cases here in Macomb and McDonough County, and so it's vitally important for us to maintain social distancing. And the recommendation across the board from top to bottom all across the country is to wear a mask when out in public, and then also to limit your engagement in public to those essential times where you're either doing banking or going to the grocery store, and getting guidance also that you should limit the time that you're in the store and shouldn't be taking your entire family with you when you go to the store. So again, not unusual, but I received 2 additional complaints, and I think I passed those both on to the council, very strong concerns from community members about a lack of compliance. And for those of you that are doing it, our gratitude, and we appreciate that you're stepping up. We would just remind as many folks out there that are not to please get with the right thing here to do. And one other thing we would remind, we put out a press release late last week that the annual spring cleanup, which would traditionally occur the 2nd, 3rd week of May, has been postponed. Waste Management advised us of that some time ago, and due to the distancing requirements and some other issues with their crew management, they've asked us to postpone that until a time that they can more adequately staff and get that done. So there shouldn't be anyone setting out any items for curb collection this early anyway, but we just want folks to be mindful of that. Don't believe we have anything else to come before you this evening. We'd entertain a motion to adjourn.
Motion to adjourn?
Second.
It's been moved and seconded to adjourn. Any discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Motion carried, meeting adjourned. Thank you very much.
Thank you.
Thank you.